Murdoch actually came to us from one of our partnering shelters. He was a shelter transfer and was a medical shelter transfer because of his symptoms and his issues. He was living as a stray, wasn't doing well. Someone took him into that shelter and they knew that he needed more extensive medical care, and they reached out and asked if someone would be willing to step up and take him. And when we first got him, one of the first things that we realized was that he was having some really severe eye issues. There were some skin issues too, but the eye issues were the really big thing. He's blind, he can't see anything. There was a lot of inflammation and a lot of discomfort there.
The SPCA's medical program is absolutely key to our life-saving efforts. We've seen a number of animals come in with gunshot wounds. Sometimes an animal has been hit by a car. We see a lot of heartworm-positive dogs come in, and other things that come from living on the streets a lot of times. Many times, by the time animals reach our doors, they are in critical condition, and we are their last stop.
So when Murdoch got here, the first thing I did was take a good look at him and do an exam. His eyes were damaged pretty extensively from the autoimmune issue that he has. And then we also see some of his other symptoms as well. The pigmentation loss, so his nose and some of the places on his face have lost pigment. There's some unusual coloring to him, and it's all related to the autoimmune issue. So we knew that the first thing that we needed to do was try to get his body to stop attacking itself. So we were able to step in with some pretty high doses of steroids and calm the inflammatory process down with him. Within a couple of days, we saw him coming out of that shell a little bit more interactive, looking for more stuff. You could see him trying to explore his area a little bit more. We were able to have him go into a foster home, which has been amazing. That made the biggest difference with him, that he's in a home where he has stability, has love, has attention on a daily basis, and help them learn how to manage their life now. So they've been able to work with him, do the halo therapy with him so that he can understand how to use those things, and just, he's like a real dog now. The medical program here is amazing in a lot of different ways, but one of the best things that we're able to do is step in these cases where we know that at a lot of shelters, at most shelters, that the animals would have zero chance at all. We kind of look at ourselves as a medical safety net for the community. So not only are we able to work with the county shelters, but we also are that safety net for the homeless pets in our area. I mean, these animals literally would not have a chance at life if the medical program at the SPCA of Wake County wasn't what it is. The fact that we have amazing donors who are willing to give us not only financial support, but also equipment support. They provide us with things that most shelters couldn't even imagine having, and we're able to provide a level of care with those things because of our donors. The amazing staff that we have. I mean, the medical program on its own is fantastic and really forward-thinking. The entire organization is the same way, though. The fact that we have such great support, not only staff, but donors, volunteers, and without any of them, we wouldn't be able to do what we could do. We wouldn't be able to step in and save a life on a daily basis. It really means a lot that we're able to give these animals the chance to find their forever homes and really become the animals they're meant to be.